Good afternoon, and thank you for joining us. Next week marks 1 year since the striking of the Dali container ship with the Francis Scott Key Bridge in Baltimore. The bridge subsequently collapsed into the Patapsco River, killing 6 construction crew members and injuring another, as well as 1 person on board the vessel. I want to once again extend our deepest sympathies to those who lost loved ones or were injured in this terrible tragedy. Today, we're issuing 4 urgent safety recommendations to bridge owners, the Federal Highway Administration, the United States Coast Guard, and the U.S. Army Corps of Engineers. Specifically, we're urging 30 owners of 68 bridges in 19 states to perform a vulnerability assessment of their bridge's risk of catastrophic collapse from a vessel collision, determine whether they need to implement countermeasures to reduce vulnerability, report their findings to the NTSB, and if warranted, implement a comprehensive risk reduction plan that includes, at a minimum, short and long-term strategies to reduce the probability of a bridge collapse from a vessel collision. We're also urging the Federal Highway Administration, in coordination with the U.S. Coast Guard and the U.S. Army Corps of Engineers, to provide guidance and assistance to bridge owners on evaluating and reducing the risk of a bridge collapse from a vessel collision. As part of our investigation, we completed a vulnerability assessment of the Francis Scott Key Bridge ourselves to determine how susceptible it was to collapse from a vessel collision, taking into account engineering and shipping advances since the Key Bridge first opened in 1977. This vulnerability assessment is essentially a mathematical risk model used to determine how susceptible a bridge is to collapse from a vessel collision, and it's not new. The American Association of State Highway and Transportation Officials, or AASHTO, developed and published the vulnerability assessment calculation for new bridges on the National Highway System in 1991. In response to our investigation of the Sunshine Skyway Bridge collapse in Tampa Bay, Florida. The state of Maryland was on AASHTO's executive committee at the time and served on AASHTO's Highway Subcommittee on Bridges and Structures, which developed those standards in 1991 and revised them in 2009. Included in the 1991 standards was a recommendation from AASHTO that all bridge owners conduct a vulnerability assessment of existing bridges to evaluate the risk of catastrophic collapse in the event of a vessel collision and take action. AASHTO reiterated that recommendation to states again in 2009, and I want to read the quote from the AASHTO guidance in 2009. All remaining existing bridges over navigable waterways with commercial barge and ship traffic should be evaluated using a vulnerability assessment in accordance with risk analysis procedures contained in this guide. The vulnerability assessments would meet NTSB recommendations to AASHTO, FHWA, and other federal agencies for improved bridge safety based on previous vessel collision accidents involving bridge failures. AASHTO continues on. Based on the vulnerability assessment evaluations of existing bridges within the state system, a screening process based on the estimated annual frequency of collapse can be used to identify and rank high-risk bridges and to prioritize vulnerable structures for potential rehabilitation, retrofit, peer protection countermeasures, or replacement. The Maryland Transportation Authority never ran the calculation on the Key Bridge, and as of October 2024, they still haven't on the Chesapeake Bay Bridge. Had they ran the calculation on the Francis Scott Key Bridge, the MDTA would have been aware that the bridge was almost 30 times greater than the risk threshold AASHTO sets for critical essential bridges. 30 times greater. And almost 15 times greater for Pier 17, which the Dali struck, as well as Pier 18. What's frustrating is, not only did MDTA fail to conduct the vulnerability assessment on the Key Bridge, they did not provide, nor were they able to provide, the NTSB with the data needed to conduct the assessment, including the characteristics of vessel traffic passing under the bridge, vessel transit speeds, vessel loading characteristics, waterway and navigable channel geometry, water depths, environmental conditions, bridge geometry, pier protection systems, and ultimate lateral capacity of the bridge piers. We asked them for that data. They didn't have it. We had to develop that data ourselves with the help of our federal partners at the Federal Highway Administration. And I want to take a moment to thank the team at the Federal Highway Administration for all their assistance on this investigation. We conclude in our report that had the MDTA conducted a vulnerability assessment of the Key Bridge based on recent vessel traffic, the MDTA would have been able to proactively identify strategies to reduce the risk of a collapse and loss of lives associated with a vessel collision with the bridge. Like the Key Bridge, other bridges throughout the United States were designed before AASHTO's 1991 guidance. To understand the scope of that risk, we asked the Federal Highway Administration to identify bridges that cross navigable waterways and are used by ocean-going vessels like the Dali, and gather information about protection devices in place for those bridges, like dolphins, like fender systems. We then narrowed that list based on when the bridge was built, whether it had a vertical clearance of at least 80 feet, and whether it had substructures such as piers in a waterway. We also evaluated vessel traffic transiting under the bridges. We repeated the same process for bridges owned by the U.S. Army Corps of Engineers. And as a result, we identified 72 bridges in 19 states, managed by 30 bridge owners that were likely not designed and built to AASHTO specifications. Owners of 4 of those bridges performed a recent vulnerability assessment and are either implementing a plan to reduce their bridge's vulnerability or will be doing so in the future. The remaining 68 bridges that have not undergone a vulnerability assessment based on recent vessel traffic have an unknown level of risk of collapse from a vessel collision, which is why we're recommending that those 30 bridge owners take action now. Frankly, we've been sounding the alarm on this since the tragedy occurred, and in testimony before the House Transportation and Infrastructure Committee last April. We need action. Public safety depends on it. So the 30 bridge owners who will receive our urgent recommendations are the Bay Area Toll Authority, Caltrans, the Golden Gate Bridge Highway and Transportation District, the U.S. Army Corps of Engineers, the Florida Department of Transportation, the Georgia Department of Transportation, Skyway Concession Company, LLC, the Louisiana Department of Transportation and Development, the New Orleans Public Belt Railroad, the Maryland Transportation Authority, the Massachusetts Department of Transportation, the Mackinac Bridge Authority, the New Hampshire Department of Transportation, the Delaware River Port Authority, the New Jersey Turnpike Authority, MTA Bridges and Tunnels, the New York City Department of Transportation, the New York State Bridge Authority, the Ogdensburg Bridge and Port Authority, the Port Authority of New York and New Jersey, the Seaway International Bridge Corporation, the Thousand Islands Bridge Authority, the Ohio Department of Transportation, the Oregon Department of Transportation, the Pennsylvania Turnpike Commission, the Rhode Island Turnpike and Bridge Authority, the Harris County Toll Road Authority, the Texas Department of Transportation, the Washington State Department of Transportation, and the Wisconsin Department of Transportation. Now, I want to emphasize, because we don't want to see headlines naming a bridge of being at risk of collapse or imminent risk of collapse. A risk level above the acceptable threshold doesn't mean a collapse from a vessel collision is an absolute certainty. Likewise, a bridge design with a risk level below the acceptable threshold doesn't guarantee that a collapse from a vessel collision won't occur. What we are telling bridge owners is that they need to know the risk and determine what actions they need to take to ensure safety. Again, I want to reiterate our exact findings today and all 4 urgent safety recommendations verbatim. For finding number 1, had the Maryland Transportation Authority conducted a vulnerability assessment of the Francis Scott Key Bridge based on recent vessel traffic, as recommended by the 1991 and 2009 American Association of State Highway and Transportation Officials Guide Specifications, the MDTA would have been aware that this critical essential bridge was above the AASHTO threshold of risk for catastrophic collapse from a vessel collision when the Dali collision occurred. Finding number 2, had the Maryland Transportation Authority conducted a vulnerability assessment of the Francis Scott Key Bridge using the American Association of State Highway and Transportation Officials Method 2 vulnerability assessment calculation, the MDTA would have had information to proactively identify strategies to reduce the risk of a collapse and loss of lives associated with a vessel collision with the bridge. Finding number 3, the 30 owners of 68 bridges over navigable waterways frequented by ocean-going vessels are likely unaware of their bridge's risk of catastrophic collapse from a vessel collision and the potential need to implement countermeasures to reduce the bridge's vulnerability. Urgent Recommendation 1 to the Federal Highway Administration. In coordination with the U.S. Coast Guard and U.S. Army Corps of Engineers, establish an interdisciplinary team, including representatives from the Federal Highway Administration, U.S. Coast Guard, and U.S. Army Corps of Engineers, and provide guidance and assistance to bridge owners on evaluating and reducing the risk of a bridge collapse from a vessel collision. Urgent Recommendation number 2, the U.S. Coast Guard and the U.S. Army Corps of Engineers is the recipient of Recommendation number 2. Support the Federal Highway Administration in establishing an interdisciplinary team and provide guidance and assistance to bridge owners on evaluating and reducing the risk of a bridge collapse from a vessel collision. Urgent Recommendation number 3 to the 30 bridge owners. Calculate the AASHTO Method 2 annual frequency of collapse for the bridges identified in Appendix B of the report that we issued today, for which you are responsible, and inform the NTSB whether the probability of collapse is above the AASHTO threshold. If the calculations that you performed in response to the safety recommendation indicate that a bridge has an annual frequency of collapse greater than the AASHTO threshold, develop and implement a comprehensive risk reduction plan that includes, at a minimum, guidance and assistance from the Federal Highway Administration, U.S. Coast Guard, and U.S. Army Corps of Engineers interdisciplinary team. And the 4th recommendations, develop short and long-term strategies to reduce the probability of a potential bridge collapse from a vessel collision. Now, a few things about the status of the investigation itself. We're releasing over 1,000 pages of investigative material in the public docket today, including our bridge factual report and some interviews. Next week, we intend to release the hazardous materials, meteorological, and survival factors factual reports, as well as a study conducted by our Office of Research and Engineering on vessel size increases and associated safety risk. In the next few weeks, we intend to publicly release the voyage data recorder audio transcripts and associated data. We're still finalizing the engineering, nautical operations, and anchorage factual reports. We'll then begin working on our analysis and developing our findings, our probable cause, and our safety recommendations with a final report released this fall. Now with that, I will take some questions. Please raise your hand. I'll call on you. Please state your name and your affiliation.
My name is Jessica Babb. I'm with Fox 45 out of Baltimore. So I know you said that the MDTA did not provide or not calculate these risk assessments on the Key Bridge. The Dali was a sizable cargo ship. So had the MDTA conducted this assessment, could they have put measures in place you believe could have prevented this collapse? And if so, what types of measures would those have been?
Yeah, so these bridge owners need to be looking at recent vessel traffic. Things have changed over time. Vessels have gotten bigger, heavier. At one point in the 1950s, we had vessels that had just 800 containers on them. Now we're talking 24,000 containers. So they need to take a look at specific measures that are included in the AASHTO guidance. So yes, MDTA would have known the risk and could have taken action to safeguard the Key Bridge.
Do you think that collapse could have been prevented, though?
Had they done that, the collapse could have been prevented. Yes.
Sure, Hamidi, it sounds like from what you're saying, these 68 bridges, the owners have not done these assessments. But do you expect that the vast majority, if they do those assessments, the vast majority of those bridges would be above the acceptable level of risk?
The question is whether the 30 bridge owners that we're issuing these recommendations to, whether we believe their risk assessment will show that they're above the AASHTO threshold. We don't know that. That is something that this is why we are urging those bridge owners to take action. We're hoping it's very few, but we don't know that at this time. We believe they don't know that, and they need to determine what their risk is and start to put in those protective measures if warranted. One thing I do want, back to your question on could they have taken action, would have prevented it, this is not new. They could have been evaluated, MDTA could have done this evaluation numerous times over the past several decades. It was recommended by AASHTO in 1991. It was recommended by AASHTO in 2009. They were part of that subcommittee in issuing those recommendations, and they especially should have looked at the change in vessel traffic, certainly after the 2016 expansion of the Panama Canal. Yes?
Thank you for taking my question. Phil Yakubuski from WBAL Radio in Baltimore. You talked about the process that they should have done these assessments. Were there warning letters sent to them? Can you talk about that? How did you keep tabs that this was not being done?
So the question is the vulnerability assessments and how MDTA had not done these vulnerability assessments. It was a recommendation from AASHTO in 1991 and again in 2009. As part of our investigation, we asked, had you done this vulnerability assessment on the Key Bridge? The answer was no. We then asked, are you doing this vulnerability assessment on the Chesapeake Bay Bridge? The answer is no. They have not. Yes, sir.
You're making these recommendations. How do you follow up on that? Oh, I'm sorry. I'm Alan Etter from WTOP here in Washington.
Thank you, Al.
Yes, ma'am. You've made these recommendations. What does the follow-up look like? How can you ensure that these measures take place?
The question is on the follow-up and urgent recommendations. When we issue urgent recommendations, we are saying There is a safety deficiency here, a potential safety risk, and you need to take immediate action. So we will follow up with all of the bridge owners. Over time, we will follow up with Federal Highways. We had a briefing for Federal Highways today. I also called the state of Maryland to make sure they knew that we were issuing this, as well as several others. So we expect action. And we have an entire team that follows up on those recommendations and will do so.
Ms. Hamdi, Kate Amara from WBAL TV in Baltimore. I am curious if the Bay Bridge is on, the Chesapeake Bay Bridge in Maryland is on the list of the 68 bridges, because I'm also wondering, if so, could that be the only bridge of the 68 where the owners knew it was on the list? Because back in May, your preliminary report specifically directed the MDTA to do short-term and long-term studies to upgrade the existing protection. So is the Bay Bridge on the list? Did they already know they were on this list? And did they give you any explanation for why, as of November, the assessment still had not been conducted?
Yeah, the question is on, did MDTA, is the Chesapeake Bay Bridge on the list of 68 bridges and its bridges and bridge spans? The answer is yes. The east and westbound portions of the bridge are on the list of 68. And then the question is about their vulnerability assessment and conducting the vulnerability assessment. We asked MDTA, are you doing it? In writing as of October, they stated no. Certainly, if they build a new bridge, they will have to. But as of the existing bridge, we know that they have not done that. Calculation, that vulnerability assessment takes a long time. There's no reason why they shouldn't have done it before now. It shouldn't take an urgent safety recommendation to get action, and we expect that to be done now. And we'll follow up.
Thank you.
Sure. Yes, sir.
Adam Tuss, Channel 4 here in D.C. People have a hard time driving over the Bay Bridge as it is right now. What would your advice be to them if the safety risk is kind of unknown at this point?
Yeah, the question is about concerns over safety and driving over the Bay Bridge. I also drive over the Bay Bridge at times. I would say the reason we are issuing urgent safety recommendations is we don't want this to occur. Certainly, the same type of traffic goes under the Bay Bridge, but at higher speeds. And so what we are trying to do is prevent something in the future. That is always what we're trying to do in issuing our safety recommendations. In this case, they need to know the risk and take action. It doesn't mean there is a risk there. They just don't know right now. So they need to determine that and do some work.
But in your opinion, is this something that drivers should factor in when they make a route choice, when they decide I'm either going to take that bridge or go a different way?
Is this something that drivers should take into consideration? I mean, drivers have to make their own decisions, especially, when it comes to their day-to-day travel. Yes, ma'am.
Vanessa Silver with Fox News Channel. Have you spoken with the Maryland Governor, Wes Moore, about the challenges with MDTA?
Have I spoken with Governor Wes Moore about the challenges with MDTA? Our investigative team has worked well with MDTA throughout the investigation. They have gotten a lot of information from them. They didn't have the information to provide. So it wasn't that they were withholding the information, but they didn't have the data that needed to go into that calculation. Why that is another issue. They should have had that data. We did the work, but they have worked well with our team. Yes, sir, and then I'll go over here. Does MDTA have the data to do a full risk assessment of the Chesapeake Bay Bridge? They've certainly had enough notice to go ahead and get that data together. This is part of our recommendations where we are urging Federal Highway Administration, the U.S. Coast Guard, and others to work with the states to help them do that. So hopefully they'll be able to take action, but this is a great question for MDTA on what they do have available for the Chesapeake Bay. Yep.
Elizabeth Worthington from WAR 2 News in Baltimore. So you testified last spring in the Senate that after that Sunshine Skyway Bridge collapse, the NTSB recommended to the Coast Guard to evaluate pier protection systems in the context of the shipping traffic those bridges see, but that was never done because the Coast Guard said at the time didn't have the authority. Do they have the authority, and are they doing that now?
And that testimony was before House Transportation and Infrastructure Committee. You know, their authority, I think, I don't know the answer to their authority. We will get back to you on that. They did not have the authority at the time. Federal Highways Administration also currently doesn't have the authority to mandate that risk assessment and those changes for those older bridges prior to 1991. But what I did testify to at that time is that bridge owners need to take action now and not wait.
2 more questions?
And then, yeah.
So, kind of two questions. Like, were you surprised by these numbers? And then also, just really get at this, why are the assessments so important?
Were we surprised by the numbers? I can say yes. We were very surprised that they were so high, 30 times almost 30 times greater than the threshold that AASHTO sets, and 15 times for Pier 17 and Pier 18. That was a surprise to all of us. But, you know, it's something that MDTA could have known and should have known. And why is it more important, you asked? It's important to understand risk so that you can take action now, implement short-term and long-term strategies to ensure public safety. Last question.
So we actually asked MDTA over the summer when we were doing a story for the AASHTO frequency of collapse calculations, and MDTA replied, this is a direct quote from them, this specification on analysis for pier protection is used only when designing a new structure to determine if / where pier protection is needed. Were they wrong on that?
They might want to, there was a quote somebody read about a response on pier protection and about how it applies to new bridges. That 1991, they might want to read their own guidance. They were on the AASHTO Executive Committee in 1991, and they were on the subcommittee that developed the 1991 guidance and the 2009 update. It says very clearly on like page 3, you should do the same calculation and risk assessment and put protective measures in place for your existing bridges before this guidance came out. So there's no excuse. Thank you so much.